Good afternoon, everybody. It's an absolute pleasure to be here. My name is Dr. Marta Vázquez-Ortiz, and I'm the Program Director of the Allergy postgraduate program at Imperial. Welcome to our virtual open day. And please, next slide. And it's a great pleasure to be spending the next hour with you. We have a nice program for this session, and that you can see now in the screen. So I will be first talking about the course for about 10 minutes, and then we have Dr. Bob Boyle, one of our academics, talking about the allergy research going on at Imperial. We will then talk about the clinical services that feed into the program, mainly the adult allergy service at the Brompton with Dr. Isabel Skipler talking about that, and then myself talking about the pediatric allergy service at Imperial NHS. And then we will have two of our lovely students talking about their experience with us in the last few years. Mrs. Myret Sihan from Ireland and Dr. Anindita Santosa from Singapore. And we will finish with 20 minutes of live Q&A chaired by Dr. Guy Scading, one of our multi-leads, and where you can ask questions through the chat. So, there is a chat for you to put questions, and these will be managed either through the live Q&A where we can discuss things, or directly through the chat by our colleagues working behind the scenes. So this is the plan for today. So I'm ready to start talking a bit about the course, and I hope this is interesting for you if you have an interest in joining the program. Next slide. I'm also a consultant in pediatric allergy at Imperial NHS. I think this reflection kind of summarizes what I think you get out of the course, and what you might be wondering in terms of deciding whether to join the program. So do you want to become an expert in allergy? I think this is what you definitely get out of the program. Next slide. So, and why Imperial? Well, Imperial is one of the top 10 universities worldwide, and I think this is a big thing, and it comes, of course, with an amazing network in terms of faculty, but also a great community of students, and you get really exposed to this great environment. Plus, Imperial has a wealth of resources to support you beyond the program, which is something we always encourage students to get advantage of. And we like saying Imperial is the home of allergy, and Bob will discuss that in more detail, but it was here over 100 years ago where allergen-specific immunotherapy was developed for the first time, and over the decades there have been really absolutely outstanding figures such as Professor Barry Kay and Dr. Bill Frankland, that again my colleague Bob Boyle will talk about. But more importantly, I think the present is really brilliant and outstanding, and we're very proud to have really outstanding academics leading many of the areas in the field of allergy and asthma, and they're our module leads, and they're very heavily involved in designing and delivering the program. So you might be familiar with quite a few of those faces if you have attended allergy conferences, and you really get very close exposure to our academics. We are very proud to have really world-leading experts as module leads and as speakers, both our internal and also our international colleagues joining for teaching. We have a really extensive syllabus covering in depth all the aspects of allergic disease, so all the different target organs, and covering from the mechanisms underlying disease to how it presents in clinical practice, how this relates to the diagnosis and the treatment options. So you really get this expertise. We have an innovative teaching approach, which is very much student-centered, with lots of interaction and lots of learning by doing, as you will see. And we have a blended learning approach incorporating both online elements as well as on-campus teaching for meaningful areas. And our program is very flexible. We're a part-time program. Most of our students are healthcare professionals working often full-time, and they continue to work in their environment, and they can progress and complete the course whilst they continue to work in their own environment. We are very lucky to have a really rich and nice international community of students, and because allergy is a global problem and presents differently in different parts of the world. This makes it very, very interesting. Next slide. So who are our students, or who joins the course? So as I said, it's mainly healthcare for professionals, but not only. We have doctors from different backgrounds, often pediatricians or GPs with an interest in allergy. We also get allergists in training, dermatologists, chest physicians, ENT, and also from other specialties like anesthesia. We have specialist nurses with an interest in allergy or asthma, dietitians and biomedical scientists, and we often have people with other backgrounds like epidemiologists or pharmacists or nutritionalists, and overall it gives a very sort of rich community. We do lots of sharing experience and lots of talking, and really people are coming from different backgrounds and brings this multidisciplinary approach that makes it really, really rich. If you're interested in seeing some comments and feedback from students, you can go on those links and have a look there. Next slide. And this is the structure of the program. So we offer 3 levels, and you can decide how far you want to get. So the first year is the certificate. Diploma will be the modules in the first year plus the second year, and you might want to progress into MSc, which involves the modules in the first and second year plus a research project that you can complete with us at Imperial. And we have offered 6 projects with Imperial academics this year, from clinical projects to dry and wet lab projects, as you know, to suit different people's interests. And just talking a bit more in depth about the modules in the first and the second year. As you see, we have a modular approach. We have 1 or 2 modules per term, and in the first year we start with the scientific basis of allergy, which covers in great detail the immunological mechanisms of allergic disease and how this relates to the clinical presentation, the diagnosis and management strategies. And now in the era of biologics, you know, it's very, very relevant to really understand the underpinning mechanisms. Then we have the diagnosis and treatment of allergic disease, which is a much more practical module where we cover all the different disease areas from a very practical approach. And healthcare professionals often find it extremely relevant to them and very helpful. And then we finish with the cutting edge of allergy, which is a module that brings all the recent advances in allergy research that have implications for clinical practice or upcoming research. And it's a module where we also give you the skills to start developing your own research projects, and also critical thinking and appraisal skills to be able to appraise the literature and decide how you want to apply that to your own area of work, be it in clinical practice or in research. And you exit at that level with PG Cert. If you want to stop there, we highly encourage you to continue at least to diploma. The second year modules are really rich and interesting. They give you a very in-depth understanding of the different disease areas: food hypersensitivity, rhinitis and immunotherapy, asthma, skin and pediatric allergy. And this is where we discuss more complex, more difficult scenarios, the challenges in practice about how to make the diagnosis, how to approach complex scenarios in terms of management, and the pros and cons of different options. And in allergy, often things are not black or white. There's quite a bit of grey and quite a lot of discussion, and we really enjoy having evidence-based discussions with our students. And I discussed the research project as well. Many of our students decide to do the research project in their own environment to try and make something that is really meaningful to them, and they always have an Imperial supervisor, a second supervisor for support. So that's another option there. Next slide. So how do we teach? What's our teaching method? So we're a blended program, which means that we have online elements as well as on-campus elements, and we're basically taking advantage of all we've learned in the last year and a half that COVID has forced us really to teach in a different way. And we've learned that there are quite a lot of things that we can continue to use because they're very, very effective. So that means that this blended learning approach will have asynchronous elements. So these are materials that will be available for students to access in their own time in preparation to, say, live sessions. And these would be lectures and mini lectures, reading lists, web links, tasks to work on in preparation for the live sessions. And then what we call synchronous sessions, which are live sessions either online or on campus. And these are, a combination of sessions. So we can have Q&As with experts on particular topics, lots of case-based sessions, and these focus discussion sessions, workshops, role play, simulation, hands-on practical sessions. There's lots of student-led sessions and group work where you learn by doing, you discuss in groups, then you come back and discuss with us, and some other sessions such as pro-con debates where you might take part, or posters or oral presentations. So an example, for instance, on how a module might be delivered, say we do a launch webinar on the first week for that particular module or term, and then you get access to all the asynchronous materials. Then about 2 weeks later, you have a 2-3 hour session, which is a warm-up Q&A and some focus discussions on basic topics on that. And then a week or a couple of weeks later, that's where we have the focused teaching week, where we want students to have book leave, for their week to really join the live sessions that are partly online, partly on campus. And then about a month later, you have your assessment for that particular module. So next slide. And then assessment. So do I have to do exams? You have to do, of course, assessment to progress into the program. And we have a number of different authentic assessments, things that you probably are gonna encounter in your professional career, skills that we think are helpful to develop. There's a written exam, but then, case reports, a mock allergy clinic practical exam, research grant application, poster presentation, oral presentation, so things you might want to do at a conference, patient leaflets, review papers, a quiz, and then the MSc thesis, which has now the format of an original article, which is again a key skill to develop. Next slide. And that's what I wanted to share. So thank you very much. And I'm handing over to Dr. Bob Boyle, who's going to be talking about allergy research at Imperial. Thank you.
Thanks, Marta. So I just want to expand a little bit on why Marta calls Imperial the home of allergy. Before we had any medicines for treating allergy, and really not long after the word allergy was introduced, Leonard Noon, working at St Mary's Paddington, which is now part of Imperial, worked out that giving injections of grass pollen to people with hay fever could prevent them from getting symptoms, and so that was the birth of allergen immunotherapy. And that's really where Imperial started to make a contribution to the field of allergy, was by introducing and then developing this treatment, which is the only treatment still that can change the natural course of allergic conditions. So Noon discovered it. Freeman worked out how to give rush protocols, so very fast up dosing to make it more convenient for people. Also working at St Mary's, and Bill Franklin, who sadly died last year in the first wave of the COVID pandemic. Bill did the first randomized controlled trial of immunotherapy, published in the Lancet in 1954. Bill was used to be a regular feature of our course and lecturer on the MSc. He's a very engaging man right up to his death at the age of 109, and continued to play a very active part in academic discussions. But Bill made a major contribution really to the world of immunotherapy. He, as I say, he published the first randomized controlled trial and then developed the largest pollen immunotherapy clinic in the world at that time. Barry Kay, who was professor of allergy at Imperial for almost 40 years, began to introduce some more mechanistic work at Imperial. So Barry was an immunologist, and he applied his immunological frame to asthma, and he really helped us understand the cellular basis of asthma. And a lot of his work really underpins the biologics that are now being used for treating asthma, which focus on Th2 cytokines, anti-IL4, anti-IL5, etc. And Barry was really the person who applied the Th1, Th2 paradigm to asthma and helped us to understand that those Th2 cytokines are really very key in driving the inflammation that underpins the intercurrent episodes of bronchospasm that characterize asthma. So, and Barry also developed a form of short peptide immunotherapy designed to be much safer than standard forms. So continue that immunotherapy theme, but really building a new world of work around the mechanisms of asthma. And a lot of Barry's work really underpins the first module of the MSc, where we go into detail around the early and late phase immune responses, which were so well characterized in some of his work. Next slide, please. That's allergy research in the past at Imperial, and I think we can confidently say that we've got a very rich and ongoing present allergy research at Imperial, with some real international superstars amongst the faculty, and that really, what that trickles down into is really high quality teaching, and also really good opportunities for research projects, for developing research careers. Several of our students have gone on to do PhDs and to become part of the sort of international allergy world, big names in research, and used the Allergy MSc as a springboard to achieve that. But whether or not you go into a research career after the MSc, having a strong academic base behind it means that the quality of the learning there is really outstanding. So I probably don't have time to go into everyone's CV in great detail, but Steve Durham has made a major contribution in immunotherapy. He was the first person to clearly characterize the long-term effect of immunotherapy, the persistent immune tolerance that you get after a course of immunotherapy, even once you've stopped the treatment. And that's really a unique feature of immunotherapy. He's been very key in developing tablet immunotherapy, starting with grass pollen tablets, which of course has become a sort of standard form of treatment for all sorts of allergens. And together with Mo Shamji, has really characterized the mechanisms of immune tolerance to a very high degree, and they've been involved in a lot of very exciting international studies and have a really outstanding laboratory which focuses on understanding mechanisms of immune tolerance, which of course immune tolerance is what breaks when we get allergies. So it's very important for understanding the basics of what allergy is, how it happens, and how to control it. Adnan Kustovic, if you've ever heard Adnan Kustovic speak, you won't forget it. He's one of the most engaging lecturers and teachers in the world in allergy, and we're really very fortunate that he's part of our faculty and gives such exciting teaching material for the course. Adnan's interest is in the origins and natural history of allergic disease, so he's pulled together all sorts of birth cohorts and other collections of patient data from trials and from clinics to understand phenotypes of allergic disease, develop better diagnostics, and understand the natural history of allergic conditions. Sijal Seglani is a world authority on preschool wheezing and the mechanisms underlying the inflammatory response in preschool wheezing. Andy Bush is a world authority on asthma and particularly measuring airway inflammation using either bronchoscopic approaches or non-invasive approaches like exhaled nitric oxide, etc. And he's done a lot of that work with Louise Fleming, who's also a very well-renowned expert on biomarkers and particularly around severe asthma. And then we've got a lot of paediatricians here in the sort of current wave, or people working at the earlier end of allergic disease, and that's just there's just been a great increase in knowledge and understanding of the importance of early immune development for preventing allergic diseases. So, and food allergy particularly, so Paul Turner, Roseanne Mayer, Isabel Skibalo, you're going to hear from shortly, very focused on understanding IgE, non-IgE mediated food allergy across the life course, and increasing interest really in diagnostics there. And Marta, our course lead, very interested also in developing diagnostics for food allergic diseases. So I'm not going to talk any more about people's individual CVs, but just to give you a smattering of an idea of the sort of range of breadth and depth of expertise that's here in the faculty, and here for you to help support the development of the learning materials, which are constantly changing in line with moving scientific knowledge, and obviously, yeah, of course, assessments and supervision of projects, etc. So Isabel's now going to give you a brief snapshot of the learning in the course around adult allergy, so allergic diseases that affect adults.
Thanks, Bob. So can I have the next slide, please? So I'm going to talk from my experience working at the Brompton for an awfully long time, and I was lucky enough to work with Barry Kay, and also very lucky to have worked for many years with Steve Durham. So we have an adult allergy team at the Brompton, which consists of physicians, nurses, dietitians, but we have also access to a huge range of support, including links with our severe asthma team. We have joint ENT allergy clinics, we have joint gastroenterology, food allergy clinics, we have access to dermatology and immunology, and a whole host of other specialist services which support our work. Next slide, please. So as with paediatric allergy, which you'll hear about shortly, a lot of the work we do is with people who have multiple allergic diseases. As I've already mentioned, we work with a specialist asthma service, but we do see patients who have asthma ourselves, because often it's part of the allergic condition that they have. So working with severe asthma, we can often get access to biologics for a treatment of our patients. And we're lucky to have expertise in upper and lower airway symptoms. And we also have a world-class occupational asthma team, which we work closely with. Rhinitis and rhinosinusitis, well, as I said, we have a specialist clinic working with ENT to look at both rhinitis, which is often dealt with in the general allergy clinic, but also rhinosinusitis with or without nasal polyps. Next slide, please. Bob mentioned a lot about immunotherapy, which of course is a very common service in most adult allergy clinics, and we use it to treat severe allergic rhinitis with or without mild asthma, and also to treat anaphylaxis to bee or wasp venom. We use both subcutaneous and sublingual tablets. The recent pandemic meant that we actually changed a lot of our patients having subcutaneous grass pollen immunotherapy over to the sublingual tablet, so they didn't need to come in to the hospital so often. And our immunotherapy service is nurse-led, supported by medical consultants, but it's led by nursing, and we discuss all our patients every week as to who we think is a deserving case for immunotherapy. And you can see we do immunotherapy to most pollens, but also to venom as well. Next slide, please. In any adult food allergy clinic, you get a lot of people who have urticaria and angioedema. This is very common in the food allergy clinics that I run, that people think when they have these symptoms that it must be caused by a food. It could, of course, be an IgE-mediated allergic reaction. We must never rule that out, but often it could be due to drug reactions, or it could be chronic or spontaneous urticaria and angioedema that isn't really linked to allergen exposure, though it can be caused by other triggers. So these are conditions that we often see, and it's really important to do a rigorous diagnostic testing and taking a really good history to differentiate between those who have a food allergy or a drug allergy and those that actually do have urticaria and angioedema that's not caused by an allergy. Next slide, please. I run the food allergy service. I'm very privileged to do that, and I think it's important to remember that when we're talking about food allergy in adults, we are talking about IgE-mediated food allergy. It probably affects about 4% of adults, but we do also see other forms of food allergy, including non-IgE, such as FPIES, eosinophilic esophagitis. However, a large percentage of patients coming to clinic could have other conditions, such as intolerances to, say, lactose is particularly common. We see a lot of people with IBS who also could have a food allergy, or they could have celiac disease. And then, of course, there are other things such as additives that can sometimes be involved. You can see from the chart here that this was a study that we published quite a while ago now, but it is a representative of what people report as being food allergies. So this is the main ones from this study were that people reported reactions to non-citrus fruits, seafood, and nuts, and those are pretty typically the most common types of allergic triggers in adults. Next slide, please. So we have at the Brompton, we undertake skin prick testing. We also undertake a hydrogen breath testing, which you can see in the bottom left-hand corner, the machine there, for lactose and fructose intolerance. And we also do food challenges, and you can see the data on the right shows, again, reflects the kind of allergies that people present with, so mostly to tree nuts and peanuts, but also a lot of challenges to shellfish, and of course 2 tests for people who are outgrowing their egg or milk allergy from childhood. So I think that's me finished, so I'm going to hand back to Marta to talk about pediatric allergy, but before I do, I just wanted to mention anaphylaxis, which of course occurs in both children and adults. And the important thing about anaphylaxis is really to determine the cause of it and then confirm that diagnosis, and particularly important to think about adrenaline and other treatments. So over to you now, Marta.
Thanks so much, Isabel. So I'm going to be talking about the pediatric allergy clinical service at Imperial NHS. Next slide. So Imperial College NHS is the UK's first academic health sciences centre with a name for excellence in clinical care, research and education, and is the largest hospital trust in the UK. Next. So our pediatric allergy service is one of the largest tertiary referral centres in Europe. We see over 6,000 children every year with a whole spectrum of allergic diseases. We are the reference for North West London, and we work very closely with the network to work together and streamline processes. And we have a focus on complex patients, holistic care and patient education. We're a UK Greek training centre for specialist specialists people doing pediatrics training specializing in pediatric allergy. We also have pediatric trainees doing SPIN training, so special interest in allergy, and we have a number of international fellowships and observers coming to the service on a regular basis. Of course, that was impacted by the COVID pandemic, but we're willing to have more observers in the future. Next slide. So we're very much a multidisciplinary team, similar to what Isabel was saying, where everybody has an absolutely key role in the care of children with allergies, particularly those with complex allergies. So we are a team of pediatric allergists, a big team of specialist nurses, dietitians, and we also have speech and language therapists and a psychologist in the team. And really the input of everybody is really, really valuable. Next. So this is the list of pediatric allergy consultants. You've seen many of these names already with our academics involved in the course, and it's really a great team of real experts with different areas of expertise, and they're all very heavily involved in the program. Often, some of the clinicians with a very clinical focus, and the academics more with a sort of academic focus, but it makes it very, very rich in terms of their contribution to the program. Next. So the areas of expertise within the allergy service, so we have a particular interest in complex multi-system allergic disease, so really the really difficult complex children, on complex food allergy, including food-induced atopic eczema and non-IgE mediated gastrointestinal food allergy. We have a focus on adolescent transition and particular clinics and resources for that. We also have a big focus on health education for families and patients to promote self-management, and an active program of translational research, including innovative approaches such as food immunotherapy that feed into the service. And you get this, a lot of this in the program as well. Next. So we have a range of clinics, from general allergy clinics to specific immunotherapy clinics, or complex multi-system allergy clinics, joint clinics that we run as allergists together with gastroenterologists or dermatologists for difficult eczema, or with their respiratory colleagues at the Brompton for difficult asthma. We have adolescent transition clinics, and our MDT, we've also developed dietitian-led clinics and nurse-led clinics, both for general allergy as well as for education in the different disease areas. Next. And then in terms of activity, we're quite busy, in addition to clinics, with day case procedures, so food challenges, drug challenges, inhalant and venom immunotherapy, as well as biologic treatment in the minority of patients who need that. And we get many referrals from primary, secondary care, and also internal referrals from the trust, from the pediatric ward, intensive care, and A&E. Next. And this is the team. Picture taken before COVID with kind of no masks and no distance, as you see, and it's a really lovely team, really rich and always happy to have interesting discussions. So that's what I wanted to present today, and I'm gonna hand over to our lovely students, and we're gonna start with Myrit, who will be talking about her experience with us. So over to you.
Thank you, Martha. Hello, my name is Mairead. I live in Dublin in Ireland, and just to give you some background information, my role in my professional life is a clinical nurse specialist in paediatric allergy. I'm lucky to work in tertiary level service in Ireland, and have done for the last 6 years. It was very important to me to progress my understanding of allergy, to get a qualification in it, and having done some research back in 2017, I was very much pointed by all my clinical lead colleagues that the place to study was Imperial College in London. So I began my studies there in 2018, and I've had a wonderful 3 years. It is a fantastic university, and as Martha said, if you want to become an allergy expert, this is the place to study. A few points I think is important for students listening, from my perspective, is to know that I came from, I suppose, travelled overseas to study, which a lot of people maybe considering, because there isn't that many places to study allergy, and so a lot of people are from overseas that go to the course, which is fantastic. I had to factor in the time it was going to take me to complete the course, the level of commitment to the course. I have a full-time job and I have a young, busy family, so all of those things were influencers on my decision. But I loved the layout of the course over 2-3 years and how well sectioned off each module is. It made it very feasible for me to fly in to London, which I had no issues with, and I think that it's important for prospective students that are travelling in from overseas that may not be familiar with London to know that it is such a well laid out city, in my opinion, for people unfamiliar. The trains, the planes, the airports, the tubes, everything was so easy to manipulate and so easy to travel. I never ever felt under threat or out of my depth as a woman traveling alone, and I think that is a really important point. The atmosphere once you begin this course is very family orientated, and I mean that in the nicest sense, that the group of students and leaders of the course are very close knit, and it's really obvious straight away that you will have a core group of very special people that you will probably know for the rest of your career in allergy after this course, and that for me made the experience very much a home from home. I never felt alone in such a big city. On a practical level, I stayed very close to St. Mary's, which is the campus I was in, and I walked into college every day. The online learning piece at home I found very doable completely, and it may be mixed this time. I did have one module that was done at home in October 2020, so I know what it's like to do a full module over Teams, and I found it absolutely fine. You can actually watch lectures at your own pace, and even the live lectures are recorded and accessible for students. So if you miss pieces when you're sitting in a lecture, you can watch it again at your own rate, and this I found very much helped my learning. I came to the course, I suppose, with a lot of practical experience, which helped me, but the fundamental allergic mechanisms and the immunology that they teach is absolutely fantastic, and it really turns you into an expert where you deeply understand why you do what you do, which I think is essential. And I think the content of the course, in my experience, even though I work at tertiary level, it is applicable to primary and secondary care as well. And the mix of people in the classroom with you brings a wealth of experience and different backgrounds, and different NDT members as well, which is fantastic. Other practical things I wanted to say was the library setup. From a distance point of view is extremely straightforward. You get great teaching face to face from the library staff when you start. They're on hand, always pleasant, always fast response. I set up my library access with no issues at home on my laptop, and I never had any problems getting onto Blackboard or seeing lectures or anything at my own time. As regards a commitment to study, it is a master's degree. It is not something that you're going to sail through with your eyes half shut. There is a commitment to do well in it, but for me, I went into this with that commitment, and my love for this area, my passion for this area meant that I wanted to soak up every paper and every article that was recommended to me and more. So I absolutely enjoyed reading around topics, and that enriched my experience. So I probably did spend a lot of time focused, and I'm just writing up my thesis now, so I'm almost at the tail end of it. Unique research at the end of this journey, which will, for me anyway, will directly influence my service that I work in. So that's hugely beneficial. On other practical levels, the skills I was taught were, how to present posters, how to write proposals, how to, create unique patient information leaflets, all of that stuff I brought back into my own practice, and it really enriched. And we'd always say it here. I work with fantastic consultants and a great MDT team, and we talk about what I brought back from Imperial so much, and I think that for me has, from a nursing perspective, has turned me into a true specialist in this area, and I'm very proud of that. And I think I wouldn't have been able to do it if it wasn't for the environment I was in, the people who taught me, and the content that is taught, which to me is literally the beating heart of allergies. So it's you're right in the center of what's happening in this area, and you couldn't be in a better place. So that's my feel on the whole thing. I would highly recommend anyone in any discipline within allergy to follow through and run through the 3 years. You'll be well supported. It's totally doable, even with a full-time job and all the other commitments we have, and you'll get huge reward from it. So any questions that come in at the end, I'm happy to answer as well. So thank you.
Hello, hi, Anindita here. So maybe I'll just share a bit about who I am. I'm actually a rheumatologist, an adult rheumatologist in Singapore. And the reason why I wanted to pursue allergy was actually my personal experience with allergy, having my own allergic disorders, having my daughter having allergic disorders as well, and obviously the clinical encounters that I have had in my clinical practice. And so wanting to pursue allergy as part of my career, and the absence of a formal training program in Singapore, scoured the net. I found Imperial College London, the PG Allergy program. I think my sister went for the same program and she shared her experience with me. So I figured, well, why not, right? And so, let me just share with you how things were for me, because, even though I intended to travel over to London for it, life had its own way of springing surprises on us. And so let me share with you how things were for me learning through the webcam. Next, please. Yep. So let's be real. Can I just click on the video, please, Helen? Yep. So I came into this basically with some expectations and some imaginations. Obviously, having read through the program, I was convinced about the curriculum. I was looking forward to studying at Imperial College because, hey, it's a prestigious place to study. It has a very good reputation. And yes, I'm Asian, so we're very type A+. We would definitely go for a place with good reputation to study. And so, the traveling was definitely an incentive for me for choosing Imperial College because I was looking forward to going to London. And I was looking forward to, attending lectures, meeting people, and of course, having been out of university for close to 10 years now, I couldn't help but being excited being a student again. Next, please. But of course, COVID happened, and so, things changed, and so we adapt, right? Next, please. And so, the question that, a lot of people ask me here locally, because my colleagues are considering joining the program, and, even recently, I had the privilege of speaking to someone who was interested in the program. And so the question was, so how did this entire web experience go for me? So next slide, please. And so the answer was, well, it is different. It was different, a good kind of different, I suppose, after you get over the initial denial that, plans change. And then came the worrying, the anxiety about, how is the delivery going to be when you're doing things online, remotely? Will I lose out on things? And, I can with certainty tell you that I didn't feel that I was at a disadvantage being away, not having any physical, interactions with people. I would have loved it still, but it is what it is, isn't it? And so at the end of the day, after you've calmed down and then you figure out your logistic concerns, and I think some of you who live in different time zones may wonder how things will go when you're many hours apart. For me, I was in Singapore, so I'm like 8 hours apart from London in terms of we are 8 hours ahead. And so, could I commit the time with my full-time job? There were concerns about, what if I can't take leave because this is an online module. It was also the height of COVID, so we had leave restrictions in Singapore. But at the end of the day, right, it actually worked out quite well. So, the asynchronous component was quite good because you could access things on the go, even at work when you had your lunch break. I used to read through the slides and everything during lunch. And then afterwards, when we had live lessons, it would be in the evening for me. And my bosses were thankfully quite understanding, so they allowed me to shift my clinic slightly later for the next day, so I could stay up until midnight or slightly past midnight to attend my lectures. And then the next day I would go to work as per usual, and things were fine. And you attend the lectures, you could listen to the recordings of the lectures. I think I especially enjoyed the live Q&A sessions because you get to clarify things that you have read up on. You may suddenly have ideas as you're listening to the other questions, and then you get to discuss more things. And I think the learning curve is not just limited to allergy, because you do get to learn about presentation skills, clinical skills as well. And for me, I think I probably learned about graphic skills. So I learned how to come up with a lot of diagrams and graphs during the course itself, and I think that served me well. I think the a bit less serious benefit to studying remotely was that I could wear whatever I wanted to wear when I was at home. So, the typical teleconference kind of fashion, formal on top and then shorts or informal things at the bottom. Okay, next thing. Yeah, so, overall, to sum it up, I think my experience has been great. I have learned a lot of things. I've made a lot of friends. The faculty has always been approachable with regards to questions, and I would definitely recommend you guys to join the program. I've just finished my PG Cert modules. I am actually very certain that I will go on to the MSc. So, I think overall studying remotely has not deterred me from actually continuing on with the MSc. Thanks. I'll be happy to answer your questions later.
Hello, I'm Dr. Guy Scading. I am a clinical adult allergy consultant at the Brompton Hospital, and I also contribute to the course. We do have a few questions, either coming in live or questions that we've been sent in beforehand. So I'm going to start with one or two of these. A lot of what we've already been asked has been wonderfully covered by the students already. So a few questions. The first one I will put to Marta, and that is, are there any funding opportunities available to take part in the programme?
Great, thanks, Guy. Yeah, that's a question we get quite often. We're offering scholarships for both UK or home as well as international students joining at PG Cert level. So we have 4 scholarships. So it's basically covering 50% of the home fees for PGCET, one of them, and 30% of the home fees for 3 of the scholarships. So something like 3,000 for one of the scholarships or 2,000 for the other 3. The deadline for applying, it's mid-July, so it's still a bit of time, and you need to put together a little motivation letter and your short CV. And we highly encourage people to apply. You need to have applied for the program to apply for the scholarships, and that gets assessed by a panel, and the results will be made available by the end of July. The Faculty of Medicine has other scholarships opportunities there. They have closed already for this upcoming academic year, so that will be for future editions.
Okay, Marta, thank you very much. So we've covered this a bit, and Anindita certainly did a very good job of covering this. But perhaps for Mairead and also Marta, you could comment on this. What's the experiences of studying online and studying during the pandemic?
From my experience, which most of my modules were face-to-face. Most of my modules were face-to-face, and just there towards the, just when the pandemic hit, one of our modules was pushed out till 2 modules pushed out till October. So that was a new experience for me, doing the full week online. It was the first time I'd ever done it. Well, there was no traveling abroad, which was, for reasons not pleasant, but at the same time, it was definitely a nice aspect to it. Exactly what Anita had said. You're sitting there half dressed, and I was lucky that I had a great relationship with the group that I had spent the previous 2 years with. So it was easier for us maybe to get to know each other and have good chats and some fun online in between lectures. What I really find beneficial for me as a learner is being able to pause lectures, think about the pieces of information you're given, and then move on. Sometimes in live lectures, there's such a huge amount of information that it's you don't always pick up everything. I'm a type of person that I like to know it all, so that really suited me. And even if it is face-to-face, the lectures are recorded, so that option is there for those type of learners that want to know, think a bit deeper about what was said, to piece puzzles together as such. So I found it both types equally beneficial, but for face-to-face, obviously you've got the camaraderie there that you won't always have online, but I still found it very good being online. So
I'm happy to comment on that as well. I mean, of course, it's been a new experience both for the faculty and the students to this current academic year having to deliver predominantly online, and overall it's been a really positive experience. I think we've been really impressed of how well students have engaged and how they've given us absolutely great feedback, and lots of the areas that have been discussed already, like the ability to really work at your own pace and lots of the materials, prepare for the live sessions. And we've worked a lot in really making sure we were allowing for lots of interaction, lots of learning by doing, and having really lots of discussions, small group work where students were able to get together in little groups. And I think, we've heard quite a few times that students still feel very close to us and very close in the groups of their sort of class. And this has been really nice to see that we've managed to kind of reproduce a bit this camaraderie and this sort of closeness in the remote environment. So we've been kind of really nicely surprised of how well things have worked, and now with kind of blended learning again and some on-campus elements, we have the opportunity to really select what's meaningful to do face-to-face and get the most out of it. So yeah, feeling positive about that.
Great, thanks Marta, that sounds excellent. My next question is, do you offer a clinical placement as part of the programme?
So yeah, I'm happy to answer that. So it's not part of the program, say coming to the clinical service and observe for X weeks. The program covers clinical aspects in a lot of detail, and it's all very carefully selected to get the most out of it in a relatively short period of time. So there is a lot about how to approach these in practice, lots about cases. Of course, if you want to sort of combine that with an observership, there is a separate route. It's not linked to the program, but for instance, in the pediatric allergy service, I'm the one coordinating observers, and we've had a number of MSc students joining, say, the weeks before or the weeks after coming to London to observe in the clinical service. It's completely separate, but for those students who might be interested, that's something we can explore.
Great, thank you. I have a question from a potential student, and I think Anandita and Marie, you've gone some way to answering this already, but they say, I work full time and I'm not based in the UK. Do you get many people like me in the program? So I suppose you're two examples of people who are like that. Were many other people on the program while you were on the program in the same boat?
Okay.
Go ahead.
Oh, okay. All right. So thanks, Marie. I think during my time, there were quite a few of us who were actually from outside the UK and were working full time. And I think, you know, we did get to bond over that as well, I think, you know, about the hardships of having to live in different time zones, you know, and all that. But I think, you know, it is doable, you know, certainly there is some logistic maneuvering that has to be done, but you know, it's definitely doable. And I think most of the places that we work, you know, would appreciate the importance of this commitment for all of us. And I think for the centers that we work as well, at the end of the day, ultimately, you know, the need for allergists and allergy trained, you know, clinicians, nurses is increasing worldwide. And I think, you know, when you are thinking about pursuing this, my advice would be speak to the people that you work with, because you would be pleasantly surprised most of the time about the amount of support that they're willing to lend you to be able to, you know, commit your time to this.
Very similar. Our group, we were pre-pandemic. I think every one of us worked full time. And Martha, correct, there might have been about 18 or 19 people, I think, at the start of that course, or maybe about 20. I mean, nobody works as hard as healthcare professionals. So every single person was managing full-time work, family commitments, and, you know, getting that study leave as such for the weeks where we were face-to-face on campus. For me, I certainly had a lot of support. I was very lucky. I probably the first nurse with this qualification from Imperial in Ireland when I finished. So and certainly the only one in my hospital. So it's very important. They were very. There was no questions about me having the time to go and bring back, as Anita Hina said, to bring back that expertise is huge. You know, if you explain really well what you're going to get out of this, I think any reasonable work environment will support you. I think it's important, how do you juggle studying? Everyone is a different learner, and I think you need to find your groove or how much work you need to do. I'm not a very last minute person. I like to spend my time studying and before I present something. So I would have committed every Saturday morning at least to doing my studies, and then certainly more time coming up to assignments being due in. So just to give you an idea of the work I put in, but then everybody's different, and I know some people are great at putting things together when the clock is ticking right behind them. I'm not one of them people. So, but yeah, you know, I think you need to think about all those aspects, especially if you haven't studied it in a long time, because you will earn your degree, you know. So
great, thank you very much. So I have one final question to each of you, and I'm going to start with Isabel because I haven't asked you anything so far. And the question is, how would you best describe the program in a single word or as few words as possible?
Well, I would say multidisciplinary is a very good word to describe it, because I think allergy is such a wide spectrum of conditions that, you know, everyone working in healthcare should consider joining this course.
That's a nice answer, Isabel. Marta.
So I mentioned the word expert a few times. I think now I'm kind of between passion that I heard May read about and then critical thinking. That is something we really encourage our students to have.
Okay, thank you, Mairead.
I've said this already, and I genuinely believe this. I really feel that this course is sitting in the beating heart of allergy research, and I think, look, and I say that as a student who sat in an evening reading research and then being taught by the researcher the next day. And I think I don't know any other course I've ever done where I've experienced that. And the fluidity of allergy research at the moment, how it shapes our practice in real time, is so rewarding and so exciting. And I think doing this course, you are just going to be plonked down right into the middle of that, which is invaluable, and you won't get that anywhere else. So beating heart, I would describe it.
Very nice. Anindita. Oh.
I just needed to unmute myself. Okay, so I think for me, this course has been the beginning of an adventure, if you would say. It's when you just set off sail to, you know, just sail out into the ocean with no specific destination. Well, I suppose you have a destination, but you don't have a specific route in mind. And I think you get to take in the sights, the adventures along the way, and to me that's what it is, actually a voyage.
All right, thank you very much. So an adventure at the beating heart of some multidisciplinary experts. That's nice, a nice overall description. Thank you all. Right, I think that's the end of the questions that I have. So I'd just like to thank you all very much. I've enjoyed listening to you. Yeah, thanks again.
Just wanted to say some final words. Thanks so much, everybody, for joining today, our colleagues and our students, and thanks so much for all the attendees for joining and sending us questions. This will be available as a recording for everybody who has registered. So we will be very happy to get any questions through the email that you see on the screen. And yeah, apply and join us for next year. Thank you.